Okay, welcome everyone. So, this is our EPAP Live election special. So as you know, our EPAP Lives are meant to be very small, workshopy kind of events where we can talk about specific issues and how we can tool ourselves and skill ourselves in different areas related to respiratory healthcare. And what we wanted to do today was to have an election special. And the reason for that is really because we are fully aware that around 49% of people living in the world will be heading to an election over the next few weeks and months. And we know we'll have one in the UK. We know there's one happening in Austria. We all know there's one happening in the United States. So it's a real active time on the political scene. And what we think is important, and actually I've not mentioned the EU elections, which are a key driver for us at the moment. But what we really need to do is to ensure that lung health is on the agenda in all elections at all levels. So we know that lung health is an issue that cuts across different policies. So environmental policies, for example, social housing policies, health and lung health in particular, really cross-cuts over different areas. I think often it's easy to think that we can't make change in politics, that it's so far away and so difficult to do that we have no place in it. And the aim of this election special was really to discuss how we can play a role in it and how everybody's voice can really make a change if we all speak up and we all speak on the same topic. So we really want to talk about passion, about having a voice and the role that you can have. As we all know, governments are supposed to work for us. So if we do have a voice and we do raise our hand and speak out, they should listen to us and they should prioritise our concerns. So we think it's important to have everybody speaking about lung health who has interest in the area, whether it's individuals or organisations. And we've really got a great group of people here today to talk to you from different aspects. So you'll hear some successes already in the field of advocacy, and you'll also hear some examples of how you can join together, particularly around the European elections and around the topic of lung health. I also just want to quickly welcome Dimitris Kontopidis, our ELF chair, who is a brilliant advocate and actually became known to ELF through his amazing advocacy work in Greece. So maybe just over to you, Dimitris, for a quick hello and a welcome to everybody.
Hello, team. Hello, colleagues. Hello, people. Also, thank you for the introduction. I just can share some thoughts about this, and I will use my experience that I was candidate in European Parliament also about a decade before. And what I realized there is that we have so many power because also the patients or the communities from the bottom up structure can has very clear vision and they have a clear statement. So a lot of times the politicians need some persons to go ahead and then they can follow regarding their targets, their political targets. So each of you make a great work in your country, but except from patients in our country, you are patients from Europe. So we can stand, in front and modify the agenda, okay, and put in the agenda the direction that we want. And what we want is to have more lung health. And all the people they wanted, they just realized in all of the things that happened every day that, okay, it's important to have a healthy lungs also. So our mission needs this opportunity. It happens every 4 years. And it's important to take advantage of it. So that was my thoughts. So let's take this challenge. And each of you, I know that you have expertise in different fields. And we can be a little bit higher for a common mission and a definitely good impact. Every minute that we will spend on this, I think we will have a big return of our mission. So let's do it in European level.
Thanks, Demetrius. That's great. If we just move to the next slide, we've got a very short housekeeping slide. So this is a meeting set up because the idea is that we'll have discussions at the end, but please do mute during the presentations. You're welcome to have your cameras on or off. Either is fine by us. Do get involved. Just bung your thoughts in chat at any point or put questions in the Q&A and then we'll talk them through at the end. You will also be able to use your raise hand function at the end as well. We are recording this session and it will be available to watch back on the ELF website and on the EPAP platform. So before we kick off with our first speaker, we have a short poll for you, and this is really just to set the scene. So how well do you understand the impact you can make in politics, do you think? Do you really understand how you can play a role and where you can make an impact, or do you really struggle to see where your voice can be heard? And then the next questions are just really whether you feel empowered to join campaigns and to be involved more in the political field. So it would be great if you were willing to answer those questions for us now, and then we will repeat those questions at the end of the session today. I'll leave the team to tell me when they want to end it. We're done with the poll.
Yep. People don't seem to want to do a poll today, so
okay, no answers. Okay, that's fine. Okay, we'll revisit it at the end. Maybe people will change their minds. And this is just the reminder of our EPAP programme, which does contain a module on advocacy if anyone is wanting to carry on their learning around this after the session today. So with no further ado, I would like to introduce our first speaker. Sophie Peru is HEAL's Senior Coordinator for Health and Air Quality. She coordinates EU advocacy on clean air for health and taking care and maintaining the strengthening of engagement on EU advocacy amongst HEAL's members and partners. And we have great pleasure in working with HEAL on a regular basis. So Sophie, over to you.
Thank you so much, Pippa, and hello, everybody. Good morning or afternoon. I don't know where we all are. And I have to say that I will unfortunately have to leave you at once. I will be super, super quick and trying to be straightforward in what I will be trying to share with you right now. Normally, you should see my presentation. Okay, so indeed, very big thanks to ELF for organizing this. It is extremely, extremely important, and I hope that you all are aware that every voice counts, every vote counts, and the two together, it's even more powerful. So here, the next big EU election that is happening every 5 years is happening in June, depending on the country where you are. If you are an EU citizen, the date is not exactly the same, but even if you're not an EU citizen, it's still a very, very important date because it is going to shape a lot of things. It is going to shape the priorities of the next EU Commission. What I wanted to do with you right now is to share with you something like a making of, if you agree. So the making of would be about air quality, about clean air, about how we changed the law, because as you know, we are still facing a very, very bad situation when it comes to health impacts of air pollution across Europe. And so this is something that absolutely needs to change. We need absolutely to combat pollution, to increase and to make lung health a lot better. So what happened 5 years ago and where are we now? 5 years ago, it was the last EU election, the previous EU election. And at that time, so HEAL together with the members we have and the partners that we work with, basically we designed a so-called manifesto, or at least a list of what we wanted to achieve in the upcoming policymaking cycle, which we are right now ending at this moment. And one very important topic for us was to ask something very clearly on clean air. And so I think we heard it already in the intro. You need to come with a clear demand, with a clear message. And this is what we tried to do. We really very simply said, hello, future MEPs, act to clean up the air. And that's happening actually at the moment, because from 5 years ago to right now, last night, a lot of things happened. I will not go into every detail, but just to tell you that along the journey, thanks to the work that you have done, that a lot of people joined to do together, we currently are very, very close to changing very much the law that is on pollution concentrations in ambient air. So what happened last night? Last night, a vote happened in the Environment Committee of the European Parliament, and that vote was a single vote where MEPs could say yes or no or abstain, and to what they could say yes, and they said yes in the Environment Committee to a deal that was reached between Parliament and Council on something that was proposed by the Commission, and that was to revise the Ambient Air Quality Directive. So the big thing was closer aligning the EU standards with the WHO guidelines. And basically, we have never been so close to this since yesterday. It is not completely over yet, but we are advancing because a few things still need to happen. It still needs to be adopted by the plenary of the parliament, and then also by the ministers, the Environment Council. But still, it's a big, big achievement, and a really big congratulations to everybody involved. Now, that was a very big summary of 5 years, so in 2 slides. How did that happen, and what is next? So how did that happen first? So basically, what I really insist on is something happens when you say something. And when you say something clearly, loudly, in a visual way, if you can, and jointly with others. So basically with repeating and echoing each other, because there are so many health groups out there right now that are doing so many really great things. And so we need to have the same messages towards the policymakers. So we had these 10 ways of how you can improve the environment to protect health that we issued 5 years ago. And surprise, surprise, we will probably do very much the same very soon. So let's see how that goes. But basically, we also are preparing our demands for the upcoming cycle. And the very, very first demand was about a healthy planet for healthy people. That seems very simple, but nothing is obvious, so you need to be very clear. And we had a few other demands. We had 9 other demands. So first of all, get the framing right. We wanted to have people at the core of whatever we do at HEAL. So the very, very kind of key element for us is to ask for the protection of the most vulnerable. So there are many ways of doing this, but basically it's absolutely key that this concept of vulnerable groups is visible and clearly visible. We had also something very clearly on climate, of course, but also on toxic-free future. I think it's important for people advocating for health, lung health, obviously, because that can also impact your health. So a lot of things that we had there. And this is the overview of all the demands we had. And actually, we have it on our website, so you can actually have a look at it. The 10 demands are there. This is the kind of recipe for healthy planet, for healthy people. And so this is in the process of being history, because the new cycle is starting very soon. And so on our website as well. After that, what happened is that we had those very clear demands, and then we conveyed them to the policymakers, because the next step when you have defined what you want is to tell what you want, and to tell that to actually the people who are going to be in charge. So what we did, and I really strongly encourage all of you to join this journey that will start again very soon for the next cycle, is actually to get in touch with those who wanted to become commissioners. So in the European Parliament, you have hearings of commissioner designates. So that's before a new commission really starts, and they get questions by MEPs. And so what you can always do as an advocacy group is to do 2 things. At the same time, you provide the MEPs with the questions they should ask, and you provide the candidate with the answer they should give. You don't do it that bluntly, but you do the same in parallel. And that's actually what we did. And we saw a lot of commitments from those who were then to become very prominent commissioners. At least Frans Timmermans was very prominent about the Green Deal and other things as well. And the Environment Commissioner and the Health Commissioner were really our big targets. So that's one thing we did. Did it produce effects? Well, yes, it did. So as you see, the framing around Healthy Planet for Healthy People, I think, has never been so prominently kind of introduced really clearly in official statements and commitments by a European Commission. So basically, our biggest demand, joint demand with members and also partners, made it into the so-called, the political guidelines by Ursula von der Leyen at the very beginning of her mandate. So what we were asking her became what she had to do in her political guidelines. So that's very, very important, because then when it's all written, it's all there, then you can build on this. But this is fundamental. You need to get to that point. It also translated into money for research, because the moment you frame things right, research calls can also be framed right. So the focus we had on vulnerable groups, not just HEAL, but others as well, really made it into, for example, a Horizon, a calls for research. So that's also very important to highlight. Specifically on clean air, because that's what I wanted to talk to specifically. Our big demand basically was alive throughout the mandate with a lot of things, but the main thing was that the Commission did propose to revise the Ambient Air Quality Directive. That was not a given, so that's something that we had to jointly advocate for. Then there was a big win in the European Parliament, and so on and so forth. So I will not go into the details here. But what is probably important is that you see that we are actually in a journey, and a journey. I mean, I don't know how much you like organizing a journey, but it's all about starting somewhere and having a very, very clear idea of where you want to go, and then basically step by step. Sorry for the image, but that's the best I have. And basically that started from the very, very beginning, 5 years ago. Maybe you remember, maybe not, maybe you were not there yet in EU bubbly things, or maybe, I don't know. So basically what happened is you had EU elections. I think last time around it was in May, and then you had a new majority in the parliament, and then the council, so basically the member states, proposed a candidate to become the next president of the European Commission. There was a whole drama last time around. It's very complicated. In the end, somebody emerged who was not a candidate at that time, and it was Ursula von der Leyen. And surprise, surprise, she is the one who then became the president. So you have to be engaged all through the process, because there are a lot of surprises. You're never bored. And you need to be able to react quickly with what? With repeating your message. So the message is your product, and then you cater for a lot of shops where you can distribute it. And the big shop here basically was, of course, the candidate for the presidency of the Commission. So before actually she had her political guidelines, we reached out to her, and we reached out with our demands. So you see, it was in July. That's my point, right? It was already in July 5 years ago that we reached out to her when she was a candidate with clear demands. And you see there was a clear demand also on cleaning the air. So from the beginning, you have to have your demands. We didn't stop there, obviously, because then you had a new commission, you had a program, work program, of course, for that commission, but as long as you don't see something happening, it has not happened yet. So we were expecting the AAQD at the time, so the Ambient Air Quality Directive, to be revised. But until it really happened, it did not happen. So we had to push for it jointly with many others, health organizations, and it includes all of, it includes a lot of those who are present here. And so you see, after 2019, we continued after the WHO published new guidelines. A year after that, we really pushed the Commission to propose its revision of the AQD. And our demand, we had a big one clear demand. We wanted full alignment with WHO guidelines. So did it stop there? Absolutely not. So if you look at our website, we are really writing a lot of letters and statements and a lot of emails to MEPs and whoever. And actually everybody has access to a mailbox. So the moment you have this, you have access to the world, really. That's your tool. That's your key to change a lot of things. It's very easy, as long as you join as you join forces. So nothing of what we did was done by us alone. Absolutely not. Everything we did was jointly done with others, coordinated, of course, very, very closely looking at what science is telling us, so very much science-based. And so just to show you what we did also very, very recently. So at the beginning of the presentation, you saw that we had a vote yesterday that we welcomed. Before that vote, we did tell MEPs how to vote so that we can welcome the vote afterwards. And we also did that with member states because they also had to vote last week. So a lot of things happening. That was about the past. And just to tell you again, the AQD is not over yet. We're still looking at the plenary votes in April. Stay tuned. That's very, very important. That's just before, that will be the last plenary of this mandate. And that will be the last moment for current MEPs to show that they're really engaged for health. So are we only looking backwards? Not at all. We are getting ready for the next policy cycle. And the next policy cycle is not only about EU elections. So EU elections are absolutely key. That's MEPs, that's direct representation, right? But as you know, at least in the EU, there's also a very, very key role for member states. Member states in the council have a big role. And one thing that they're going to do is they're going to produce a so-called EU strategic agenda for the next policy cycle. Actually, they already started doing this. They're already starting preparing this. And this is absolutely important for us because this is where the current member states, the heads of member states, are basically designing what the priorities are going to be according to them, and they will adapt it to the EU elections outcome, I guess. But basically, at this moment, the strategic agenda does not exist yet as such. There is a lot of things happening, but it's not finalized yet. It will be adopted, as you can see, in June after the EU elections, but it is being prepared very much right now. And there is one moment where it's really, really going to be important is when member states, so heads of state, are going to talk together and have an informal meeting in April next month, actually. So also that is very important because it will go together with the EU elections in the parliament in terms of shaping the future. Now, super quickly on a reminder, or just telling you, because maybe you don't know, why is it so key, instrumental that people go to vote for the EU elections if they have the right to do it. If you have that right, please use it, and please ask people to do it as well. That's copied from the Parliament's website, so you can just go there and see how the Parliament communicates itself on its own powers. But basically, the most important sentence here is the Parliament approves the EU budget. The EU budget is absolutely key for us civil society. So that's super important that we get the right MEPs deciding the right things for the EU budget. Also, the Parliament scrutinizes how the money is spent, but actually very, very soon after the EU election, one of the first things that the Parliament will do after having appointed its own president, actually its own chair, the Parliament will elect the president of the European Commission, and it will also appoint basically the commissioners and hold them to account. So this is absolutely instrumental. And here my two last slides, just telling you a bit of a flavor. Where are we right now in terms of polls? So that's the most recent one I could find. This is how the projections look like. So basically you have a big majority of not really progressive coming up, and that's something we have to deal with and to live with and to work with. So that's the projection, and just that you can see how it compares to what is currently the case. So you see the change between the two is actually a move to the right and to the far right. So this is the reality we live in. So never more than before is it so key that everybody goes out to vote, those who can, and also that we have very clear demands. And I will stop at this. Thank you.
Sophie, thank you very much. That was a brilliant talk, and I think great to see the history and how you worked through the last political period and how you're looking forward to the future. I know you have to dash off, but there was just a comment by Jean-Michel in the chat about the relationship between EU level and national level. And you have mentioned it a couple of times, why it's important, that connection between the two. But perhaps you could just say a few words about activities at national level being important for EU level politics.
Thank you so much. That's a very good question. And basically, there is one legal link to say that a big proportion of national law is transposed from EU law, if it's a directive, or it's directly implemented if it's a regulation. So, for example, for the case of the Ambient Air Quality Directives, once it's adopted completely and published in the journal, in the official journal, it will then start being transposed into national law. So basically, by going to the EU level, you are actually impacting very directly the national level. One thing to say is that very often national politicians tend to forget this very important element, that actually EU lawmaking is not necessarily only done in Paris or wherever, actually not that much. And so very often, if they are working on something that people will like, they will say we did it ourselves. And if they're working on something that they know people will not like, they will say, oh, that's Brussels that decided, with completely forgetting to mention that they are themselves a part of Brussels, what they call Brussels, especially for big member states. Remember that nothing gets agreed if, for example, France and Germany don't think it's a good idea. It's very unlikely that it will become anything like EU law. So this is why it's so important to get involved and at the national level, and also because we know that the EU elections are very often 27 national elections in a way, because very often people don't campaign on EU topics, but they campaign on national topics, which is a bit of a challenge. But nevertheless, it's for us to navigate through that ocean.
Answer, Sophie. Jean-Michel, did you have anything else to add or ask, or did that sort of, yeah, thumbs up, brilliant. So yeah, no, I think it's great, and I think it's so hard to see that sometimes, isn't it, Sophie? Like why, how they influence each other. And I love what you were saying about, if it's bad news, it's all Brussels' fault, and if it's good news, it's national. It's so true, so true. And this is talking from someone in the UK, and you know how that went. So thank you very much, Sophie. That was really great. Please do run off to your other commitment, and we thank you very much for joining us this morning. It was really helpful. So next I want to introduce our lovely friend Michaela Odermeer. So she is currently the Patient Advisory Committee Chair of ELF, and she's also the President of the Swedish Asthma and Allergy Association, but she's played lots of different roles in different organisations with EFA and others. She's been involved in patient advocacy for more than 15 years. She's got a great story to tell you, and I think this will bring it more home to some of you. It's really a personal experience moving into an organisational experience, but you know, Michaela's story can really show you how having a personal interest and a personal commitment can have an impact on the political field at both national and European levels. So thank you, Michaela, and over to you.
Thank you. I will share my slides there. Hang on a minute. Does it work? Yeah, oh, it worked. So thank you so much. Yes, I was thinking of the talk that Sophie gave, and now I'm going to talk through my journey from a patient side. So I will set the first. How can patients drive the agenda for change?
Sorry, just to mention that we're seeing your slide deck rather than the presentation.
Oh, I see this. This was
sharing the wrong screen.
Oh, hang on a minute. Oh, wonder where they. Hang on a minute. I'm so sorry.
Don't worry, don't
Yeah,
worry.
There's
uh,
a screen with a green arrow at the top.
yeah.
If you press that, I think that'll take you
I will start again. I think
Okay.
that's the best. So, and see if this works.
Yeah, we can see your slides. If you press the little box with the green arrow in at the top of the PowerPoint presentation, it will go to the presentation mode.
Is it the present? It's looked like that on my screen. Otherwise,
Oh, okay.
is it working now?
No, we still see the back officey view.
Okay, what, Michaela, I'll share it from this
Yes,
side. No
please. So
problem.
then I
Okay.
can keep talking.
No worries. You start talking. I'll just
Yeah.
like.
Yeah. Now I will walk you through the journey, how it all began for me, and also that last week, I'm on the first slide, the picture of me, and then we can move on.
There we go.
There, thank you. We had a very big victory here in Sweden after years of advocating, and I want to really share that experience with you now. So next slide. So what made me start advocating? Yeah. Well, I can tell you that I didn't know anything about asthma or allergies, but when my son was born, then a whole new world started. Not only I didn't know, like I said, anything about the allergies, but also the right to have the right care and fight for the right diagnosis. And he was going to start kindergarten or school, and it was so difficult for people to really understand how, is he really allergic? He doesn't look like that. And what I didn't realize back then is that I was advocating for people that have asthma and allergies. And I joined an association, you can take the next slide, and meeting others in the same position as me. This is the reason. This is my 3 children. And of course, I wanted them to go to school like anyone else. I wanted them to be included in the society. And also, in the long run, they are now, this is an old picture. I want them to go to work, do sports, and also really have a good quality of life. And I started together with the association on the local level, talking to politicians. And my biggest task at the beginning was there was no allergy kindergarten where we lived. And my son and daughter were so allergic, so it didn't work at in a normal kindergarten. So I started, like Sophie said, talk to the right people. So I talked to politicians, I talked to decision maker, and trying to make them understand that they will feel much better if they are in this kindergarten, and then then they can start school. And after a year of advocating, this was just a small victory, but then we had our first kindergarten. You can take the next slide. And now and like I said, I started at the local levels to be engaged, but then I started to work for the national organization. And in Sweden, between 1989 to 2001, there were authority. Oh, I hear myself now. Oh,
And then unmute if anyone needs.
Yeah, but between 89 and 2001, there was authority working with allergy with allergy questions, and then they stopped and we tried. I don't know what's happening. I hear myself. Some kind of recording. I don't know.
Maybe someone's unmuted. Try again.
Yeah. And the Swedish Association started from 2001 to advocate how important it is to have a Swedish national allergy program, because we saw that many people were getting allergies and asthma, and then this is not a work from me, this is decades back. Me and many presidents, many people in the office and members did an amazing job. And we were talking about how important this was. And in 2008 in Finland, they started a Finnish allergy program, very, very good success. And we followed that work closely. And in 2019, it was a Congress in Sweden. We have a Congress every 3rd year. And then we focus more on 3 goals that was on air quality, like we've been talking about, and food allergies and care. And then, like Sophie said, tell what you want and what kind of demands. So we made 5 demands, what we wanted. Because the evaluation of the Finnish program after 10 years it was a success. The allergy burden has gone down. The cost for the society and for the individual were very positive. So we set those 5 goals that we want to reduce the allergies if possible, and the people who has allergy, that they get the right care. We will have national guidelines, and we will also increase the knowledge about asthma and allergies. We need more doctors, allergists, and we also need that there's more research on these topics. And as you can see, it takes time, so never ever give up. And we organized then into this Congress and started to work with these topics, very focused. So we can go to the next slide. I can think of advocating like stairs. We started, it says here, this is in Swedish, and I mean, every government looks different, so I left it, but think of it as stairs. We had something called the allergy lift. That was a big conference where we lifted up the topic, and we have invited the right politicians, the right decision makers, and we were very honored that the Queen opened this. This was an online, it was during the pandemic, but it was an online event, and really set the spot on this is problems, but this is also how we can solve this, just like Sophie said. And then in the East, the autumn of 2021, there was in the government, there were motions about it, how things that could be done much better, and it was needed for us to have a Swedish allergy program. And then the following year in spring, we were invited by a politician who was very interested in these questions. And the former president, who was here today, I saw her, was there also and talked about how important this is for patients to have this program. And then in some month in the government, these departments they had an initiative saying, I think we really need this. This is really good. And then after the summer, the government says, well, I will give those 2 authorities this mission to work on if we need a Swedish allergy program. And they had 1 year to evaluate that and work on it. And the conclusion were, we need it. And this last autumn, I spoke also in the government saying how important it is to have a strategy. And then last week, it was announced that Sweden have an allergy program. But like you saw before, this was during a long period. And like I said, it's many people who have helped. But it's crucial that you speak to the right person, to the right politician, who actually have the power to make decisions. And make sure you have a clear message. Make sure that you really tell what you want, but also you can give solutions. Or you can also, we did several surveys, so we know how the situation looked like in Sweden, that the care was not equal, that you would get even different treatments depending on where you were living. It was like a lottery where you were living and which doctor you saw. We can go to the next slide. Oh, there, yeah. And again, I just want to say, this is not a one-man job. It's not me, or it's a teamwork. and always have a positive attitude. I said back in the days when I was fighting for my children, that I was a tiger mom, but with a positive, I was a positive fighter. I think this is crucial because then you're listened to, and again, focus on solution, and again, make sure that you talk to the right person. And I saw this picture on, I think it was on Facebook actually. It said, yes, I did it, but I wanted to say, yes, we did it, because it was actually how it felt last Tuesday when the government announced that Sweden will have an allergy program. So what I was doing in the beginning, advocating for my children to have the right care, the right diagnosis, be involved in school and everything. This is what we do now, which I do for the members. So you can advocate and you can make a change. So never, ever give up. So I just want to encourage everyone to keep up the good work, because we are so important, and go to the election because your voice counts. Never forget that. Thanks.
Thank you so much, Michaela. I think that's just a beautiful journey from your, coming at it from a parent, and, as a mum of two myself, I love the term tiger mum. When you get mums who have a passion, there's nothing as strong, I don't think, and dads as well. I don't want to, but mums with a passion are particularly strong. We're going to leave the questions, I think, Michaela, till after Isabel's spoken, if that's okay. I see Lisa's already posted one for you, but we'll come back to that in a moment. But thank you for sharing your story, and I think it's brilliant. And the fact that the asthma and allergy programme came through last week in perfect time for this event was wonderful as well. So thanks very much, Michaela. What Michaela has talked about in her presentation, and also mentioned by Sophie in hers, was the importance of teamwork, the importance of working together, speaking with one voice, and really, having strong and clear messages. And hopefully that's going to be a real theme of our next speaker. And our next speaker is Isabel Prano, who is the Director of Policy and Communications at the European Federation of Allergy and Airways Diseases Patients Associations, EPA. So I know many of you know them. They are an umbrella patient group that has 45 national patient associations in 26 countries. Isabel is hugely active in all of EPA's advocacy work towards the EU institutions, but also the WHO. And we've been working together with EPA on a campaign at European level, really focused on lung health. So I really welcome Isabel to come and talk to you about it. And hopefully you can see a concrete way that you can get engaged in these EU elections and to help with this Keep Breathing campaign. So over to you, Isabel.
Thank you, Pippa. Thank you for the invitation. And I want to thank, before starting my presentation, Michaela Oldemir for your contribution to the community, the work you are doing in Sweden, and the work you are doing and has done at the European level. So thank you very much, Michaela. It's about messaging, it's about sustained action, and it's about partnership. And this is why I wanted to present on the Keep Breathing campaign, an initiative of the European Lung Health Group that is a partnership of 9 organizations, many of them today present in this meeting.
Isabel, sorry, just to let you know, the slideshow hasn't started yet. Oh, that's fine.
Slideshare has not started yet.
I think it has now. Thank you.
Logo, okay. So what's the European Lung Health Group? It is a collective initiative that was launched in 2020, already strategized in 2019, so before the COVID pandemic. We are gathering 9 organizations that are representing 179 member associations across 34 European countries. It is a partnership between healthcare professionals represented by the European Respiratory Society and European level patient groups, all the European level existing patient groups that we know about: Alpha 1, CF Europe, EFA, ELF, EU PFF, LUCE, PHA, and TB, the Tuberculosis Europe Coalition. We're working together for better prevention, respiratory care and research, and patient participation. And we are making one voice of the very wide medical spectrum that is lung disease. As you know, non-communicable diseases, respiratory allergies, asthma, chronic obstructive pulmonary disease, lung cancer, cystic fibrosis, common infectious diseases that are hitting the headlines every year at national and global level, like tuberculosis, pneumonia, severe acute respiratory syndrome, COVID, and rare and ultra-rare respiratory diseases, of which there are many, but those that are structured at EU level advocacy, alpha-1, idiopathic pulmonary fibrosis, and pulmonary hypertension, among many others. So we together came up with the Breathe Vision for 2030, a document that sets priorities for the community, for the European level patient advocacy together with healthcare professionals first. And this was launched in 2021. Now, why we got invited to present you this today is because we are at campaigning mode with the elections at EU level, but also across many countries in the world. And we are messaging, putting together a storytelling, compelling narrative about lung health. You heard Pippa talking about lung health. The approach is to, while remaining about disease-specific topics, to communicate to those that might not be a patient, that might not have a diagnosis yet, and to communicate about lung health because everybody has a pair of lungs. So lungs are the core of everything we do as an indicator of cardiovascular, immune, and cognitive health, and much more, including mental health. And yet, aggregating all the data that we have from the latest available data from 2019, which is 1 in 8 deaths at the EU level due to respiratory diseases, 611 billion euro annually cost of poor lung health in Europe, and 87 million, and we know this is an underestimate, of Europeans living with lung condition. So at the European Union level, this opportunity of the renewed mandate for a parliament and for a commission, we are demanding to step up action on health within the European Health Union, this new initiative launched after COVID, with funding and action on health to improve lung health. This is the Keep Breathing campaign, where we say our only policy is to keep breathing when you are a patient, and also when you are not a patient, so to reduce fragmentation of knowledge and policies around lung health at the European level. And if you visit the European Lung Health Group website, being informal, which is called breathevision.eu, you will see we have launched this document, A Vision for EU Action on Lung Health 2024-2029. We take it as not only having the elections in June, but also to having a vision for the next 5 years mandates, reinforcing also what Sophie was meaning about how do you actually get to policy change. Now, what is this EU action on lung health? So we are telling the EU institutions that they should be working on different sectors, but earmarking this as lung health. 3 pillars: prevention, care, research, and innovation. And while this is an easy slide, I want to show you the next slide, which is just singling out the most important legislation that exists at the moment and that affects lung health. Not only those that might be cross-cutting, like, for example, universal health coverage, or human rights, or occupational exposure legislation. Really go into where lung health could be singled out in the current and upcoming legislation. So all this that you see here is a table, a 3-pages table, just noting the different legislation that is currently transposed at national level and is coming from the European level governance. And it is also in our policy brief. We thought that it could be a good exercise to show Commission officials, EU agencies, and MEPs the the wealth of legislation that is already affecting lung health, impacting lung health, or looking into decreasing lung health or respiratory disease. Now, we go back to the different building blocks. We are talking about public health prevention policies and crisis preparedness policies after COVID, about care policies, which are like access to the treatments, how these treatments are being authorized at European level, immunization, reference networks for rare diseases and inequalities in general, but also research and innovation. As you know, the EU has good and rich resourced funding programs for innovation and research. They can be applied to data, artificial intelligence, to environmental health, but also to the looking for the new treatments and novel therapies for our disease areas. Now, what have we done? What are we doing together in the Lung Health Group to bring about to this audience of European Union level audience these briefs, these findings, these calls, is to address them where they are. First, we have done an event at the European Parliament with health champions for in the European Parliament. We launched it in end of February, only a few weeks ago, and there was the first time that a member of the European Parliament was talking about lung health. The really first time when this was quoted, reported, and contextualized on an initiative coming from the healthcare professionals and doctors together. And these MEPs, they are here and quoted and in the picture, are crucial for lung health and for health in general at the European Parliament. Some of them will be running the elections again, some of them won't, but in any case, even if they step down from the European level governance, they will go back to their national level, as we have seen, for example, with Pizarro, who was also a member of the Lung Health Group and became Ministry of Health in Portugal, left the parliament for that. So investment on European MEPs, so members of the European Parliament, is important also for national advocacy. So they were talking about resilient healthcare systems. They were saying that investing on the next preparedness and response for the next pandemic, thinking about lung health was a very good way to strengthen healthcare systems. They were also talking about funding for European level action on lung health, and it was very interesting and definitely a milestone for the whole community. What we have also done is to organize a high-level forum on lung health with European Commission and EU agencies. This has been a closed event because we wanted to have a discussion, honest and transparent, with those that are preparing already the next mandate on how to work and promote better lung health in Europe. And here we a cross-ministry high-level meeting. We had in one same room 5 directorate generals, which equals 5 ministries at national level. Those ministries were the health one, the structural reform for member states, environment and climate action, more or less 25 participants, and also the participation of the European Medicines Agency and the European Environment Agency. It was very revelatory that, as it happened for the meeting at the European Parliament, they immediately were talking about lung health themselves. It was very easy. And they were talking about breathing, about lung health. So we are seeing that at European level, the narrative of lung health might give us more entry points and access to politicians that the narrative of a disease-specific action need. So I just leave it here for the discussion later. Now, what we had was a strategic EU-level discussion, starting with the budget, because we are facing cuts now. for EU budget on health, despite COVID, but also for lung health-driven initiatives on prevention, promotion, care, and research. At the moment, I'm sure you've heard that the EU is working and devising on a beating cancer action plan, and it's also working on a mental health initiative. So we see that those, despite promises, do not fully cover the spectrum of lung health disease, and that maybe lung health should also have specific EU action. But we also went very in detail with each of the ministries and agencies, 7 services together, about policies on access to care, diagnosis, screening, medicine shortages, and digitalization, also public health policies, the air quality legislation that Sophie just mentioned, but also tobacco legislation, and awareness raising, the partnership with civil society organizations, like the ones of the Lung Health Group, and also health crisis preparedness, especially towards future respiratory infections and climate change adaptation. Now, what can national patient groups and individual patients do? Certainly get familiarized with this brief, the one that you can see on the right side image, because that has a narrative that is very easy to uptake. It's part of the Keep Breathing campaign, and as I said, all the European level organizations will be using it for the next 4 years. Then is to vote. Vote as a patient, vote as a citizen if you are an EU national, for those that will offer more health insights into their next mandate. And also organize together with your organization and with other partners, high-level cross-ministry discussion at national level. I know that the International Respiratory Coalition is creating coalitions at national level. It could be a very good way to start creating and developing relations and finding the right people that Micaela was mentioning before. There is a strength in numbers. When addressing your disease area, link it to the broader picture happening at European level and to the broader picture at national level. I'm sure this data that we are putting together at European level is also available at your national level. And then, of course, join and share the Keep Breathing campaign with your network. You see that we are making a connection between what breathing means for a human being. Sometimes we have this image that life starts with a heartbeat. Maybe life starts with an exhale and with an inhale. So we are going to have this very, very soon, this logo as a filter, as an option for social media. And we will be using it and circulating across the whole community to really show what a lung is, because sometimes this is not well known by, the average population. So you can always follow European Eurolung Health and the European Lung Health Group on LinkedIn and X. We also have a YouTube channel with testimonials. And at the end of the day, as Micaela was saying, this is also about people and individuals. The ones that you see here in the picture, I'm sure you know them. Those are advocates, board members of the European level organizations. We say we stand ready to collaborate with European Commission, with member states to take the care of citizens' lung health and to realize the vision for a healthier, stronger Europe, and that our only policy, our only commitment, our only drive is to keep breathing. So we are asking them what's theirs. And that's all. I'm open for questions, looking for the discussion.
Well, and thank you for keeping on time. Perfect. Thank you very much. Great. Well, if we can bring back Micaela, unfortunately, Sophie had to leave us. But Catherine, if you could pin Micaela as well. And if people want to turn on their cameras, please feel free as well. We've already got a couple of questions in the chat. So Micaela, Jean-Michel loved your story. And his question is, how did your first contacts with politicians go? And how did you feel about fitting in? Did you have an inferiority complex? Did you think, why me to talk to these people? Yeah, can you give us some insight into how you dealt with that?
Yeah, actually, I remember well my first meeting, because it was on a regional level. I was discussing about asthma care in our region, but here comes the most important thing. I'd done a lot of research before, so I had all the numbers of that what I was going to talk about, and I remember the politician was sitting there with the arms crossed and say, "Oh, are you saying that? But have you thought about this? And are you sure that those numbers are right?" And I said, "Yes, I am." And since I felt sure, since I'd done this research, it felt really good talking to them, and like I said, in a positive way, and trying to explain. I mean, I know the backside if you don't get treatment. And this is what I was trying to say to them. So I would say, but I started at a local level. I think it's good that you work your way up also, so you can and get to know that there are humans also. So so that is not another species. So just think of them as a human, discuss the problem and the solution.
Thanks, Michaela. And I pinned you as well, Demetrius, just to warn you, just to join into the conversation as well. What about you, Isabel? How do you feel in your interactions? Because, you know, you're inviting these people, sometimes harassing these people, sometimes, you know, going to them with things that they don't want to talk about, or that they're busy with lots of other groups coming and talking to them. I mean, what goes through your head, and what are you thinking about when you approach different individuals?
Hello, that's a difficult question to reply, but because it really depends on who are you really addressing. But after the years, I've realized that there is no stupid question, and that sometimes because we have limited resources, we might have limited time to discuss with a politician, we might go making the wrong assumptions. They are not aware of our topics. They don't know what these diseases are. They don't realize how much power they have in their daily work to make a difference. And what I have learned is that we should not assume, I should not assume that they know and that they can come up by themselves with the solution if we don't try to tell them and understand what they know about the topic. So it's about a conversation. Sometimes we go with our speech, you're given 10 minutes, you need to put your messages across, but take the time to start with, what do they know?
That's good advice, Isabel. And Demetrius, any more to add on that? I mean, you've met the Prime Minister of Greece, etc., in your kind of advocacy journey. Were you intimidated, or did you feel like you had a good story to tell and, you know, a good message to convey? How did you approach it?
I think the politicians in this period is that's they want. They want somebody to bring an issue, but prepared, well prepared, so they take the benefits. So if we have make all of this preparation, they would love to join. And even if it's some difficult, things that we are want, if we describe them more, not so sharp, and then if they agree, then we do the sharp thing afterward. But they are looking for communities and tasks the community ask for, and they can be very easily go. And of course, we have to choose the perfect, not the perfect, the combination of strategy, approaching from different political parties, representative, and to be like very clear that I want everybody of you, because, for example, the health is a common field, so nobody will have, an issue on this. So it's an opportunity. I see only opportunity, and we hear so many good stories of best practices, and I think we can engage more people on like this description that happened today. in a national level. So great work, everybody.
Great. Thanks, Demetrius. So there's a question from Lisa. So she said it might seem like a daft question, but how do you know you're talking to the right person? And maybe I can ask you that question first, Michaela, because I think Lisa posted that during your talk.
Yeah, I think it's a very good question, first of all. Now, I would say again, it's research. So depending on where you're going, you have to see, okay, where do I go if I want to have a success in this question? How is if it's the government or is it authority? How is the structure? So I go to the right person with this question so I can influence. Otherwise, I mean, it's nice to go to talk to people, but if they don't have the authority to make decision, I think, then it's, I wouldn't say pointless, but it's really important doing this research. And this is also where we went as an association. We had some people who are very good how the government was structured, which authority we should talk to, what we started then in 2019, 2020. That is the success also. And if you are lucky, when you talk to a politician and they know something about the disease, the burden, they will listen a bit more. I can show you that.
Thank you, Michaela. And Isabel, I mean, you've done, I think, a fantastic job within your activities about really reaching out to different sectors and perhaps some sectors that we wouldn't normally think to communicate with. Perhaps you could say a little bit about that. You know, should we be reaching out beyond our safe connections, and how could we think about doing that?
I think definitely we should dare more. We should dare. When we are meeting a politician or a service, I know there is a bit of having an approval from them that, okay, I go to the health ministry because it's my topic, right? But there is also an ambition to be heard, to already bring the topic to those where you think the topic should be addressed. This is what we are doing at the European Lung Health Group, for example, engaging with the Climate Action Directorate or engaging with the Environmental Agency. That is very important, but on the collateral scope to access to healthcare. And I think that daring is giving us a lot of visibility. I can tell you, in the last meeting, this closed meeting that I mentioned before, there were questions around the community. Are we really going to get 6 ministry level at the Commission and 3 agencies? Well, some thought, if we don't try it, we will never know. And we tried, and we got 5 out of 6 ministries and 2 out of 3 agencies in very difficult circumstances of traveling, and you know, they have a very busy agenda. So to me, it's about daring, and then also to trust that your topic is sufficiently well positioned and sufficiently well explained to them, meaning on what are the competencies they have and the responsibilities they have to be forced to care about your topic. Because we are non-for-profit organizations, grassroots organizations representing vulnerable people. And actually, what we have heard recently is that we will look at you, or we can listen to you more because you represent vulnerable groups. So dare to go, dare to ask who they will send, who will they, and how. That's something for them to decide. You cannot decide on who you want, but connect with the institution. Connect with the institution, and they will see what is the most relevant and feasible for them, and then build a relationship from that. The people represent an institution. The importance is the institution. People change.
Thanks, Isabel. So floor is open if there's any other questions. Please feel free to post questions in chat or to put them in Q&A, or put your hand up and ask a question. We'd really welcome any questions from anyone in the audience. I mean, Michaela, Isabel, Demetrius, have you got any questions for each other? I mean, Michaela, what are your next steps now? I mean, does it have to, the announcement, does that mean it's concrete that this asthma and allergy plan will now go through, or does your advocacy continue?
The advocacy continues, obviously, because it's a strategy now till 2026. And after, and of course, we will be the association, and we will answer questions when they are doing those different investigations and surveys and what's needed. And so we will be there, support them. And so the work is not done yet. You still have to keep on going. But again, teamwork and collaboration with many different people, that is key. Like I said, this is a no one-man job. This is teamwork.
Absolutely, absolutely. Well, we have 3 minutes left. So perhaps, oh, Isabel.
Yes, because I see a question from Jean-Michel that I think is important. It's a very
Sorry,
good question. And you are asking that the economic part is taking the place of healthcare services and care quality. And I agree with you. In terms of the narrative, how an issue or a topic is being put forward. But I personally tend not to see that as opposing to the advocacy work we do. It might be an opportunity. If the next commission, next parliament, is much more about the economics and the costs, that can be an opportunity for our advocacy. It means that we say the same, but we package it into the economic terms. If we go more into prevention, environment, being more sustainable, we package our topics under the sustainability message. So I don't see that it is a challenge or a threat. I see it requires a bit of work from us to be ready, to be creative also.
Great. And yeah, thank you for picking that bit up, Isabel. I'd missed your question, Jean-Michel. And actually, I've just put a link in the chat, which is to the Lung Facts, which is where we've tried, together with the European International Respiratory Coalition, to come up with economic figures for the burden. And Isabel has used it in some of her presentations about the keep breathing. So we have some big figures. So 420 billion, I think it is, for the economic impact of lung disease at a European level. And so we do also have data that we will be able to come back with in that economic argument. And yeah, there obviously is concern as well around this 1 billion that has been taken out of the health budget recently. And I think that really shows us that there's no more important time to be vocal and to be talking about the importance of lung health and the value of health. And, you know, it's said many times, health is wealth. So I think that's absolutely true. And Lisa, yes, feel free to use that data. It's fully available. You can download the figures, you can use the graphs, and please feel free to contact us if you want any help or any other figures. We have all the background data, so we're really happy to provide you with more national figures or local figures or whatever it is that you need. So with that, I think we're at end of time, if I'm right. And I'd just like to thank everybody for taking part today. We are recording this, and I know lots of people signed up, so hopefully they'll come back and also watch this. I think it's a big call of action to everybody to vote primarily, but if you can and you're interested, get involved at a higher level. Contact us at ELF, read the information on the Keep Breathing campaign. You know, really come to us and talk about ways that we can support you to get involved. Thank you for everyone who took part, and we'll hopefully see you again at the next EPAP live session. I'm just going to check with Catherine that there's nothing I've forgotten.
No,
maybe.
great.
Brilliant. So thanks to everyone. Thanks to our wonderful speakers, really inspirational, and we'll see you again soon.
Thank you, everybody. Take care.
Thank you. Ciao.
Yeah, bye-bye.
Thank you, and keep breathing.
Yeah, and keep up the good work.